brain is firing from the left to the right and from the right to the left properly, it inhibits this. It slows it down. It doesn't let it shoot down, fire down with this high frequency. And therefore you get normal function. On the other hand, if one side slows down because of injury or a subluxation or a particular problem, then it's not inhibited, it begins to fire a lot. So I'll give you an example. The third and fourth cranial nerves come out of this area in the mesencephalon, and they are what control the pupil. So if they're not working correctly, the pupil dilates, so it doesn't contract when it's exposed to light, therefore you become sensitive to light. It's because one side of the brain is not balanced properly, it's not inhibiting it, and it's overfiring. Let's use another example. The intermediate lateral cell nucleus here, it sends nodes, it's below the medulla oblongata here, it's what sends firing signals down to the SA node and the AV node in the heart, sinoatrial node, atrioventricular node. Now, what does that mean? Well, the sinoatrial node controls primarily the upper part of the heart, the atrioventricular controls primarily the lower part of the heart and the left side of the heart. Okay, what you'll see is that if this is not functioning correctly, on, say for instance, the left side of the brain is underfiring, so the right cerebellum is underfiring, so the right SA node is not firing, what you're going to see in these people is sometimes increased pulse, high tachycardia, or bradycardia, slow heart rate. Or they'll swing back and forth. Real fast heart rate. These are the people that say when I stand up, you know, my heart will be at maybe 75 beats a minute and then suddenly it'll go to 110. In other words, it overreacts to any stress. It's like a dysautonomia. That's a term that's used. Because this isn't working correctly. The control mechanism is not working correctly. Now let's suppose you got it the other way around. That you have the AV node over here is not functioning correctly because of the balance on the right side of the brain over here. Well, what happens over here with these people, these are the people that will tell you that they have an irregular heartbeat. Preventricular counts. The heart appears to skip beats. That's what causes these palpitations in many instances, is an imbalance here. Interestingly enough, scientists have done research with drugs like Inderol that they use to control irregular heartbeats, and they found out that it actually, initially they thought it worked on the heart, now they begin to realize it works on the brain. That's how it actually controls the irregular heartbeat. Yeah, they found that out. Now, let's use another example here. Let's suppose, again, you have the imbalance. The mesencephalon is overfiring, and it's firing farther down the spinal cord out to the kidney. Now, what happens here? Well, this could cause the kidney to malfunction, so this is why people say I get up in the middle of the night and urinate frequently, because, again, the imbalance up here. Also, there's an organ that sits on top of the kidneys called the adrenal medulla, and it is what secretes mineralocorticoids, catecholamines, cortisone, these types of hormones. And also, if they are over-secreted too much, what happens is that it causes the pain receptors in your body to become hypersensitive. And that's why you have these people sometimes developing osteoporosis because they're mobilizing too much calcium, and they're also become hypersensitive to pain. That's how you get going with the fibromyalgia. So it's all related back here to the nervous system. Now, what do we do? And first of all, how do we find out what's going on here? Well, that's where being a board-certified chiropractic neurologist comes in handy. We do a very, very in-depth examination. It's the type of examination that your medical neurologist should be doing on you and was trained to do, because that's who trained me to do it. And I'll give you an example. What we're trying to find out in our examination is there an imbalance between the left and right hemispheres and the left and right cerebellums that control the left and right sides of the body. So I'll give you an example of how this might go. We might look at somebody's eyes, and we'll notice that one pupil, say on the right side, is dilated relative to the left. That means that the inhibitory control on that side is decreased. So that would indicate a weak brain on that side and possibly a weak cerebellar firing on the left side. Okay, let's suppose we did a simple Romberg test where we had the patient close their eyes and stand there, and typically you'll see people sway a little bit, but if they start to sway too much, or if they really just let it fall, say to the left, that would indicate a weak cerebellum on that side and probably a weak brain on the opposite side. Let's suppose we did a pass pointing test where we have somebody try and touch the finger to the nose. They may do okay on the left side, real smooth, come in very smooth. But on the right, they'll do one of these things. In other words, the coordination is off, indicating that the cerebellum is not functioning correctly. So this is how we do this. Now, I gave you a very simple version. The exam we do takes about 45 minutes to do this, but we have the patient going through various types of tests with the eyes. Particular movements will tell us which one of the cranial nerves are not functioning correctly. We even do smell testing, where we test the ability to smell various odors, because that has a lot to do with the part of the brain that functions, and it can tell us what part is not functioning correctly. We do an in-depth neurological and orthopedic examination on the body to find out exactly what's going on. And once we do that, then we arrive at a conclusion about what to do. Now, this is where we comes in with the chiropractic. We do a type of adjusting called unilateral adjusting, and also chiropractic biophysics. It's kind of peculiar, but it actually makes a lot of sense neurologically. We actually, in many instances, adjust our patients standing up, because I want the load effect of gravity on their proprioceptors, that's the stretch receptors all over the body, to be activated properly so that we can get a proper balance. But what we will do is, let's say, for instance, we have somebody with a underfiring right brain and an underfiring left cerebellum. Typically, these people will present with a posture like this, because the way the cerebellum activates mostly upper body contraction effects on the muscles, you'll see a depressed left shoulder on that side. Not always, but this is a common thing. What we will do is, we will do a chiropractic biophysics adjustment. We'll put the patient into the opposite posture, do a series of stimulations up and down the spine, not moving the vertebra, stimulating the spinal cord to send signals up to the brainstem and into the cerebellum and up to the brain hemispheres themselves. And when we stop it, you'll notice the posture will correct. Second thing we'll do is we will stimulate basically the upper part of the body only unilaterally. So again, if it was weak cerebellum on this side, weak right brain, we would only do the treatment and stimulation of the upper extremities on the left side, because we're trying to fire signals over to the right to get the balance. You see, the brain has a thing called neuroplasticity, which means that it can be facilitated. You can, just like a muscle, you can build it up. So if you take a brain, if you take a series of nerves that are underfiring, and you get them to fire more regularly, it's just like a weak muscle. You get it to exercise more regularly, and by golly, it'll get stronger, and pretty soon it'll keep up and it'll start to balance. And when the hemispheres balance, it stops the excessive firing down through the mesencephalon, down through the spinal cord, and the symptoms abate. That's how we do it. Okay, that was the chiropractic part, kind of a simplified version. We use a combination of cold lasers, alpha stem, and acupuncture to do these stimulations, and we get very, very good results. We have patients who put up with this for years and years and years, and they didn't have to. It could have been fixed without drugs and surgeries. You know, it's out there. We know how to do this stuff. Now, there's another component to this, and that component is nutrition. I'm going to go over that in a few minutes, in the next video. And we're going to cover the topics, and also I'm going to have something posted on the website. We can go to it and see the written version of this, because this gets kind of complicated. But it shows you some of the things we can do to, number one, improve neural function. Number two, improve the creation of energy inside of the cells. And number three, get rid of the pain. And it can be done. It's done all the time. We just have to know how to do it. And we're going to show you how we do it. We'll take you to the next video in a couple minutes.